I do autism assessments for a living, and you'd be really surprised to know what an actual comprehensive assessment consists of. It's not just a quick in and out the room, it usually takes about 3 to 4 months. I'm Dr. Murati, I'm a licensed clinical child psychologist, and part of my job is conducting autism assessments, so I'm looking to rule out the diagnosis. If it's done properly, an assessment has multiple parts. First off, parents and teachers will complete rating scales to look at how a child scores compared to other kids. Second, I usually come up with a testing battery that looks at lots of different areas, including their cognitive abilities or IQ, their developmental skills, their autism symptoms, usually through a play-based assessment, their speech and language abilities, which sometimes can be done through an interdisciplinary approach by a speech and language pathologist. Also, I like to get a look at their medical history, their behavioral history, their school history, and also their social history, not to forget their family history. I'll also do an interview about an hour to an hour and a half long to ask their parents about different symptoms from when they were an infant to a toddler. And finally, I'll do my own behavior observations and I'll fill out some forms that are standardized to see how they score in terms of their autism symptoms relative to what I'm noticing and observing in session. So all this data usually takes about 2 to 3 sessions to compile, and then once this is done, it takes about a month or so to write up a report and then have feedback with the family. At that point, I'm talking about results of the evaluation, whether or not they meet criteria for a diagnosis, what level the diagnosis might be, and I give plenty of recommendations and lots of time for families to ask questions and follow up if they want to afterwards. I hope this answers your questions. Let me know if you want me to dive a little bit deeper into what is actually going on.